there are lots of misconception when it comes to conception. I am Dr. Sunil Eshwar, fertility specialist and laparoscopic surgeon at ICAF Fertility, Bangalore. We have been talking about male infertility and semen analysis. I would want to try to clear certain misconception or myths about semen analysis. We have already spoken about it in the previous videos, but I just want to kind of summarize it, right? So first misconception is, if I get one report saying that I have an abnormal semen analysis, that's it, and I have no other way to change my future faith or my whatever, the hane bara, whatever. No, sorry, that's the wrong thing, because semen analysis, if you do today and do it after 2 days, it may change, it may be different, because count numbers change, your health impact also changes. Next is semen analysis. Any semen analysis needs to be very crucially seen. It's not that everyone is expert enough to look at a semen analysis. See, semen again is a very special kind of investigation, because we need to look into different parameters. Not all lab technicians have been trained, or all lab has a facility enough to understand or give a proper report. So my request is, do this analysis in a good reputed lab, or a lab which particularly deals with fertility issue, or in any fertility center. And we also now have started using automated semen analysis, which use lots of artificial intelligence. To a large extent, they give a very accurate report. So trying to do it in a better lab setup, or where you can get an automated report, will always be better, because it reinstills faith in the report. If we get a semen analysis which is abnormal outside, we generally repeat the semen analysis in our lab. Many a times we don't charge though, because we just want to be sure that what we are seeing is right. So next is semen analysis, which I have already told about the values, which like any count is not a bad count to say that you cannot conceive. So if anyone says this semen analysis says that you cannot conceive, nowhere it is written, until it's a zero count. I'll come to the zero count again in the next video. You can see my next video on zero count. So any count is good enough to conceive, though the way of conceiving will be different. Do we need any treatment to improve the count is also a question which you need to ask. How long to wait if your semen analysis is abnormal, or we are facing a difficulty to conceive? This is a very practical question, because once we get a semen analysis which says it's abnormal, there is a panic within the patient, telling, oh, now we will have to do things faster, we need to conceive faster, otherwise things are going to bad. How do we analyze this, and how long can you wait? The question comes is, how long can that couple wait to the semen analysis to be corrected, or parameters to improve, or we say, okay, if this is not going to work and we need to move on to the next stage or next way of managing the system. So this will depend on the age of the couple, more so with the age of the female partner, the comorbidities or problems associated with the female partner, and also the problems associated with the male partner. So if, for an example, it's a young couple who has been married only for maybe 1 or 2 years, and the female partner's age is somewhere around 23, 24 or 25, I would rather say anything less than 28 years of age, and she has been analyzed, and it says that her uterus and ovaries are normal, her ovarian reserve is normal. That says that, okay, we have a fairly good amount of time in our hand. Maybe 6 months or a year, you could try to do whatever treatment, lifestyle changes, and put you on certain treatment to improve the count or motility. In most of the time, what we have seen is, when we put them on this kind of a treatment, quite number of patients do conceive while on this kind of a treatment itself, like some lifestyle changes, and they get a bit serious, because anyone says that if you not conceive, it comes up to the male's ego, says, okay, no, I need to make sure that the semen or my parameters improve. So they start doing, I think, lots of lifestyle changes, which brings about increase in the parameters and assists in conception. So as I said, How much time to wait is a situational question. Nowhere it says that you cannot conceive with whatever the semen count, as I said. So you just need to be a little bit more patient enough to understand your situation and discuss with your fertility expert as to what are the options for treating it. Next question is number of days of abstinence. As I say, minimum 3 days, not more than 5 days of abstinence, that is either by either sexual intercourse or by ejaculation. So minimum 3 days of abstinence should be there and not more than 5 days. But if you come from a far off place and it will become more tedious for you to go back and come back again and do the test, it is still okay to go ahead and do the semen analysis. If the semen analysis completely comes as normal, so it doesn't have any significance telling, oh, we have to come back again 3. Yes, if there is any abnormality, then yes, we need to look at number of days of abstinence. But when a good lab technicians or a good andrologist will be able to pick up and say what is the effect of either the less abstinence or a more prolonged abstinence, and then they can give the corrective factors and say, okay, fine, this is a normal semen or this is really an abnormal semen parameters. So number of days of abstinence is not really very significant. You can go ahead and give the test anytime, but it will be ideally 3 to 5 days. Age of the male partner does not matter. That's another misconception, because as we know, with increasing age, we are very sure as concerned to women, the egg quality and the number of eggs do come down, but to some extent, yes, it happens even in the males. Now, we are not immune to so much of environmental changes which are happening. We are not immune to the medical disorders which are affecting the whole population. And in India, we know that it's diabetes is an epidemic. So most of them will become diabetic in and around age of 40, 45 or 50. If your lifestyle is not good or if you're not taken care of it, the diabetes will affect your accounts, your medical conditions. If you're on any antihypertensives or any other anti-cholesterol drugs, any chronic illness can all affect the semen parameters. And it's also said that over the age of 50 there is some amount of decrease in the count motility, more so in the parameter of morphology. So age does affect. So do not postpone things to an extent where we say, okay, fine, this is a very difficult situation to handle. So don't be in that feeling that macho, now I can wait till 50 years, 60 years and try to conceive again. Next is ejaculation. It has to be done in the clinic. No, not really necessary. If you stay very close to the clinic or the lab facility, then you could probably collect it at home. Ideally, it has to be carried by the male partner itself or the male person itself, because it gives authenticity, and also you will be more careful than anyone else. We've seen that sometimes they say we'll send it through my driver or to my office boy, and sometimes all this the parcel services are there. So no, doesn't work like that. It will be always better that you carry it. What's the time limit? Up to 45 minutes to an hour is still okay if you are able to carry it, because we can deduce out of that as to what is the impact of delay in the time which has happened, right? These are certain misconceptions about the male part of infertility and the semen analysis, which happens to be the most pivotal investigation in male infertility. So any more doubts, any more misconception is there, probably you could write to us. We will try to answer as many questions as possible. Thank you.